morning, everybody. Yesterday we made good progress and we still have a number of agenda items to discuss today, but I'm confident that we will do this efficient and maybe we finish a little bit earlier today. We will now continue with agenda item 5F, Partnership for Health in the WHO European region. The relevant documents are contained in EUR/RC67/17-Rev1, and the draft resolution is contained in EUR/RC67/ConfDoc7-Rev1. Partnership is very important for our region, and we are always happy to see so many of this present also at the regional committee. We have heard already from many partners this week on how they are going to collaborate with us on the priorities set by this regional committee, and we are very pleased with that. To open this item, we will hear from our final voice of the region, Brit Tover from Estonia, who is also with us in Budapest. Thanks to all the voices of the region for their valuable insights. Please start the film.
My name is Brit Tover. I am a medical student from Estonia, and I am the current regional director for Europe in the International Federation of Medical Students Associations. IFMSA and WHO go way back. We are in official relations with WHO, and we have a lot of collaboration going on. So every year we send a large delegation of medical students to the World Health Assembly. We also send medical students to all the regional committees, including the Regional Committee for Europe. In addition to that, we participate in different WHO processes and expert groups, and similarly, WHO comes to us to participate in our meetings and contribute in that way. Partnering with WHO has been throughout a positive experience for us. I mean, thanks to WHO, we get all these opportunities to participate in decision-making processes and to talk with other civil society members and with governments. Some people have viewed us as a coordinator. However, what I believe is true is that a lot of civil society organizations that came to the regional committee last year and in previous years have begun to realize that if we want some change to happen, we have to find things that we agree on so that we find a mutual stance to present to all the member organizations in the plenary. This year we went in with a real desire to find a compromise, and what we found was a group of other NGOs equally willing to compromise. So what we ended up with was a number of joint statements. It's really important for civil society to be able to agree on its demands on these big issues that we fight towards, and it's because these problems are really vast and they are very difficult to tackle. And if we want governments to do something about these problems, it's important that we give them a coherent message, because it's all too easy to do a lot of partial solutions, but what we need for these problems is a fully thought out solution. What are the chances that we might be able to tackle these major health issues without partnerships? Probably zero, or slim on a good day. If we are going to achieve the 2030 agenda, we really don't just need to step up the financing, we also need to step up the collaboration. And a part of that is engaging civil society more in all processes that gear towards the development of our nations. There's only one way to transform our world, and that is by breaking the status quo. And there's a reason why the status quo is so hard to break, is because it's comfortable. You know, people feel safe doing what they've always done. But if we want governments and really everyone else to come out of their comfort zones, then we need that extra push. And that push can really only come from civil society working together.
Parem tervis kõigile!
I would now like to invite Ms. Leen Meulenbachs, WHO representative to the European Union and Executive Manager for Strategic Partnership, to introduce the document and the related resolution. Leen, please.
Thank you, Madam Chairperson, Regional Director. Ladies and gentlemen, thank you for coming out so early this morning to discuss partnership. The WHO Regional Office for Europe is currently collaborating with a large number of partners, ensuring policy coherence, adjusting priorities in line with changing environments and respective mandates. I want to acknowledge the work of many of my colleagues here, and especially of my teams in the regional office and in the WHO office in Brussels. Over the past years, we have regularly updated you on the activities of the regional office in the area of partnerships. We invited high-level representatives of the European Union, the OECD, the Global Fund, the Gavi Vaccine Alliance, as well as different UN agencies and representatives of civil society. Many of these partners have been attending this year's Regionals Committee session, and you have heard directly from them about our collaboration throughout the week. Now, we want to step up our partnership work, and the 2030 Agenda creates new opportunities and challenges. SDG 13 on partnerships for development especially advocates for building stronger multi-partner and multidisciplinary partnership at an international, regional, and national level. This requires a shift of focus, not only strengthening strategic work with partners at the regional level, but developing strong partnership at national and subnational level as well. Furthermore, the adoption of the WHO framework of engagement with non-state actors provide also new opportunities for collaboration. Let me start with one partnership you all know. The European Observatory on Health System and Policies is the only hosted partnership of the Regional Office of Europe, and it brings together various partners, member states, international and national organizations, and universities. Its excellent work is well recognized and appreciated, and we will continue our close collaboration with the Observatory in many areas and be an active and engaged partner as well as a host. The collaboration with the UN agencies has always been strong, and especially in recent years, this collaboration has been further expanded under the UN Regional Coordination Mechanism. WHO currently is leading an issue-based coalition on UN agencies on health-related SDGs, and we actively participate in other regional working groups, such as the Working Group on Gender, the Interagency Network on Youth Development, to give a few examples. At country level, WHO engages actively with the UN country teams. The WHO Health Emergency Programme, with its aim to broader partnership, is also closely engaging with relevant UN agencies, and you have heard all about this earlier this week. The reform agenda initiated by the UN Secretary General will guide us further to strengthen this collaboration in the coming years. The collaboration with the European Union and its institutes has been presented to you in the past on various occasions. This year, you heard from Director General of DG Sante, Mr. Prats-Monet, on his vision for future intensified cooperation. And in many technical briefings, colleagues from the European institutions have been participated to present our joint work. As emphasized earlier by the Regional Director, now we are working with DG Dr. Tedros to renew our strategic partnership and collaboration with the different EU institutions and WHO at all levels. This work has just started, and surely we will report to you in the coming months. We also have a memorandum of understanding with the Commission of the Regions, and that was signed recently and currently is being implemented. It allows us to broaden our collaboration also at regional and sub-regional level, and even with cities. In the past 2 years, we successfully initiated to scale up collaboration with an increasing number of global health partners and regional organizations. I'm not going to list them all, but let me particularly mention some recent initiatives, such as the collaboration with the Health Council and Interparliamentary Assembly of the Commonwealth of Independent States and the Eurasian Economic Union. As you heard from the Director General, we are embarking on a transformative partnership that can work at all levels: global, regional, national, and subnational, and that will involve different sectors and the civil society. It is one of the Director General's leadership priorities. This will require building up capacity of staff for partnership development, identifying additional opportunities, and foster cooperation at country level. A special focus will be given to support WHO country offices in mapping, identification, and building relations with national and international partners. Let me now turn to our collaboration with the non-state actors. As you know, the framework for engagement with non-state actors includes a procedure to apply for official relations status with WHO at global level. This allows non-state actors to participate as observers in the WHO governing bodies, as you heard also in the voice for the regions. FENSA also allows the regional offices to set up their own accreditation process for regional non-state actors in official relations. Not in official relations, I'm sorry. The draft resolution proposed to you reflects a proposal to set up such an accreditation procedure. The objective is to enable European, regional, and sub-regional non-state actors not in official relationship with WHO to participate in the regional committee as an observer. The eligibility criteria proposed are similar to those for global official relations, and the collaboration, of course, will be reflected in the WHO register for non-state actors, as is requested in FENDA. The timeline proposed is clarified on the slide, and it is clear to us that the final decision for the accreditation is taken by the regional committee upon the advice of the standing committee. Before ending my presentation, I would really like to thank all partners for an excellent collaboration, and we very much look forward to continue our joint work towards common goals and in support of the implementation of the SDGs and Health 2020. Thank you very much.
Thank you very much for this introduction, and I now open the floor for discussion. Member states wishing to speak, please raise your nameplate. And I give the floor to Estonia.
Thank you, Madam Chair. The EU and its member states welcome the adoption of the framework of engagement with non-state state actors and the efforts by the regional office in implementing it. However, we would like to use uniform wording regarding FENSA across all regions from the FENSA resolution. I would like to draw your attention to the amendment, which is already reflected in the distributed copies, conference document /7 revision 2. In operative paragraph 3, in the proposed new wording for Rule 2 of the Rules of Procedure of the Regional Committee for Europe, in the first sentence after the words framework of engagement with non-state actors, delete the word will be and deliberations, and add the words are invited to participate in the sessions. The full sentence is now so. Non-state actors admitted into official relations with the World Health Organization pursuant to the framework of engagement with non-state actors are invited to participate in the sessions of the Regional Committee as provided for in paragraph 55 of the framework of engagement. This is directly from the paragraph 55 of FENSA and has also been submitted in writing. Thank you.
Thank you very much. Estonia, on behalf of the EU, are there any other delegations wishing to speak? I see none. Then we will move to observers. And I would like to give the floor to the International Federation of Medical Students Associations.
Honorable Chair, distinguished delegates, the International Federation of Medical Students Association has long realized the importance of strong partnership, and we would like to take this opportunity to thank the WHO and its European Office for the meaningful, long-lasting partnership. Investing in partnership does not only increase productivity and the contribution towards global health, but also provides a platform for capacity building and fruitful communication. We believe that the framework of engagement with non-state actors serve as a fine example of how the development of partnership in the complex global health landscape and remaining invested in monitoring its impact. However, we must also be careful while engaging with the private sector and aware of potential conflicts of interest between partners, including WHO and its member states. We strongly support the replacement of the sentence of Rule 2 of the Rules of Procedures and appreciate the efforts towards strengthening the collaboration with non-state actors already in official relations with WHO, while at the same time not forgetting about the unused potential of non-related NSAs by potential equal access. Inclusive engagement of all possible partners is an extremely important aspect of meaningful youth participation. We therefore encourage the implementation of the procedure and hope that it can lead to an increase of youth involvement as a direct result, as we sincerely believe young people's input in WHO is essential. Only someone who understands the age group from personal experience and is directly affected by youth programs can help create the most effective policies for youth. We thank the member states who have included youth delegates in the WHO delegations and are happy to assist others in setting up youth delegate systems of their own. Furthermore, we are looking forward to presenting you our proposal for the creation of the institutionalized youth space within the WHO, the adoption of which may very well promotely open the doors towards European progress and partnership for health with youth actors. Thank you.
Thank you very much. I have no more NGOs on my list. Therefore, I will ask Ms. Mühlenbergs to respond to this debate.
Thank you, Chair. I think there is not much to respond to. I thank everyone for the participation. I trust that not speaking does not mean that there is no consensus or no interest in partnership. Thank you.
Thank you very much. Before concluding this discussion, I would now like to consider the adoption of the proposed draft resolution contained in EUR/RC67/ConfDoc7-Ref1, Partnership for Health in the WHO European region. Is the committee willing to adopt the proposed draft resolution as amended by consensus? I see no objections. The resolution is therefore adopted. We will now continue with agenda item 3, matters arising from resolutions and decisions from the World Health Assembly and the Executive Board. The relevant documents are EUR/RC67/Rev1 and EUR/RC67 INF-Doc 3, INF-Doc 4 and INF-Doc 5. We will have a separate debate on each of these documents. First, on the overall report as contained in EUR/RC67/6 Rev1, followed by a discussion on the INF-Doc 3 on the development of the draft 5-year global strategic plan to improve public health preparedness and response. Then on the INF-Doc 5, development of a draft regional plan on vector control. And finally on INF-Doc 4, developing voluntary global performance targets for road safety risk factors and service delivery mechanism. The outcome of our deliberations on this topic is an important element of the report of the President of the Regional Committee to the Executive Board. It is our opportunity to present the views of our region in the global debate. We have 1 hour for this discussion, so without further ado, I now invite the Netherlands as the Executive Board member liaising with the Standing Committee to give his presentation. I'm not sure he's here. Yeah.
Dear Regional Director, dear colleagues, I'm giving this statement in my capacity as liaison member of the Executive Board to the Regional Committee and the Standing Committee. During the 70th World Health Assembly, for the first time ever, all member states voted to elect the new Director General. Clearly, this has been the most remarkable event for WHO this year. But let us not forget that we also adopted 16 resolutions and 24 decisions. My presentation will briefly summarize and highlight those technical agenda items and resolutions with particular importance for the European region and that are not addressed elsewhere during our discussions at the Regional Committee this week. In Category 1, Communicable Diseases, Resolution WHA 17.14 on strengthening immunization to achieve the goals of the Global Vaccine Action Plan was adopted. Within our region, the European Vaccine Action Plan was adopted in 2015 and progress on implementation has been steady. However, accelerated action and political commitment is needed in order to achieve our goals. Thanks to the Secretariat for scaling up their actions to support member states to tackle challenges and welcome the regional office's proposal to intensify this support and especially move forward with a more cohesive strategy to address the challenges faced by middle-income countries. In Category 2, non-communicable diseases, there are several resolutions that I want to bring to your attention. Resolution WHA 7011 preparation for the third high-level meeting of the General Assembly on the prevention and control of non-communicable diseases. Within our region, there are several resolutions and decisions adopted to address the various risk factors of NCDs, such as nutrition, physical activity, tobacco and alcohol use, and also overall policy framework on NCDs. Health 2020 policy and monitoring framework includes main elements of NCDs, and monitoring of and reporting on NCDs has been at the forefront in the region, and the very high level reached in previous years should be maintained. Resolution 7012, cancer prevention and control in the context of an integrated approach. Cancer is high priority in our region, and it is a leading cause of mortality. The commitment to tackling inequalities in cancer risk factors, exposure, and in access to early diagnosis and treatment are fully in line with the Health 2020 framework. Resolution WHA 70.13, prevention of deafness and hearing loss. The emerging challenge here is the increasing exposure to noise in occupational and recreational settings and the increase of elderly populations. There is no specific action plan currently envisaged for our region. The wide range of causes and potential interventions for prevention and mitigation of hearing loss are shared among several programs. In relation to the decision on WHA 7019 on the implementation plan related to the report of the Commission on ending childhood obesity, the main principles of the implementation plan are aligned with Health 2020 and are already being implemented by the European member states. While many good practices from our region are included in the recommended comprehensive set of actions on the implementation plan, it is clear that further implementation can help us to halt the rise of childhood obesity in our region. The actions to prevent childhood overweight and obesity should be scaled up. The decision WHA 7017 on the Global Action Plan on the public health responses to dementia. The burden of dementia in the region is high, particularly among people over the age of 60 years, as well as its burden on health and social care systems. Many European countries in the region are active in addressing the needs of people with dementia, as well as their caretakers, while facing many challenges, including increasing financial implications to the health and social sector. The main strategic directions of the European Action Plan on healthy aging in Europe provide guidance for implementation. Under Category 4, Health Systems, I want to particularly draw your attention to Resolution WHA 7015, promoting the health of refugees and migrants. Our region adopted the first strategy and action plan for refugee and migrant health last year and has been leading this work, which has been instrumental for the global developments. Through the evidence and experience of European member states and the work of the Secretariat, there is greater understanding of the public health aspects of migration. Many technical and policy briefs have been developed jointly with partners to support member states. The global strategy that will be prepared by 2019 will build on the progress made at the regional level. And finally, in relation to preparedness, surveillance and response, I draw your attention to Resolution WHA 70.7, improving the prevention, diagnosis and clinical management of sepsis. Since there is a strong link between prevention, diagnosis and treatment of sepsis with other technical areas such as infection prevention and control, AMR, immunization, etc., the regional office will take its work on sepsis up in an integrated approach in line with several other strategic documents already endorsed. The following resolutions and decisions from WHA 70 have been discussed earlier this week or will still be on our agenda later today. The resolution WHA 70.16 on global vector control response will be covered during our discussion under this agenda item when we review the draft regional implementation plan of vector control. The regional implications of decision WHA 70/22 on progress in the implementation of the 2030 Agenda for Sustainable Development was the topic of our Tuesday discussions. The role of the health sector in the strategic approach to the international chemical management decision WHA 70/23 is included in our review of the European Environment and Health Process, which we also discussed on Tuesday. During our consideration of the agenda item on a sustainable health workforce in the region, we also covered the regional implication of Resolution WHA 60.6 on human resources for health. And finally, there are two decisions under Category 5, preparedness and response, dealing which are discussed already on Wednesday evening when we considered the acceleration of implementation of IHR. Dear ministers, representatives, I only provided you a very brief overview of some elements from the regional committee document before us. But it is clear that we have a lot to do, both globally as well as within our region. Thank you for your attention.
Thank you very much, and thank you very much to the Netherlands to accept to be the link between the Executive Board and the Standing Committee during the last year. Ladies and gentlemen, I now open the debate, and I request member states wishing to speak, please raise your nameplates. Estonia, please. Followed by the Netherlands.
I am speaking on behalf of the European Union and its member states. The candidate countries, Montenegro, Serbia and Albania, the country of stabilization and association process, and potential candidate Bosnia and Herzegovina, as well as Ukraine, the Republic of Moldova and Georgia align themselves with this statement. The European Union and its member states welcome the development of the draft 5-year strategic plan to improve public health preparedness and response. We would like to recall the legitimacy and binding nature of the international health regulations and the importance of the national focal points. It is every member state responsibility to fully implement international health regulations to protect their population and thus contribute also to global health security. Furthermore, it is every member state responsibility to fully report diseases and events in accordance with the regulations in order not to undermine our joint work and commitment. The European Union and its member states agree on the guiding principles and pillars for public health preparedness and response. For this moment, we have the following remarks on these principles and pillars. Country ownership, intersectoral approach, and partnerships are key in strengthening international health regulations. We stress the importance of developing national whole-of-government plans for preparedness and health security capacity building, including health sector plans, integrating the recommendations based on the recommendations from the WHO monitoring and evaluation framework, including the voluntary external evaluations. To do so, we encourage countries to be evaluated by WHO to be able to develop these national plans. It is also important to align them with national budget cycles and donor coordination early in the planning process. Efficient response to health emergencies is a high priority for WHO. Strengthening response capacities in all countries, in particular in those most at risk from health threats, is an equally important. Integration of the international health regulations in national health system is an important strategic principle too. We are convinced that strengthening core capacities, including essential public health functions, should be an integral part of health system strengthening and efforts to achieve universal health coverage. And fully, we would like to stress that regional integration is more than developing regional plans by the regional officers. Cooperation with regional organizations, such as European Union, is essential. The European Union and its member states have obligations through the implementation of the European Union decisions and serious cross-border threats to health and its cooperation programs, including for risk communication and assistance through the European Medical Corps and other bilateral supporting structures. We are ready to work closely with WHO regional offices and with the WHO office in charge of preparedness and capacity building in this regard. We look forward to participating in the formal consultation in November in Geneva. Thank you.
Thank you very much, Estonia. And I now give the floor to the Netherlands, followed by Norway.
Thank you, Madam Chair. The Netherlands aligns with the statement made by Estonia on behalf of the EU, but my intervention mainly focuses on the development of a draft regional plan on vector control. The Netherlands is a strong supporter of the global vector control response that was adopted at the Health Assembly in May this year. The problem to be tackled by the global vector control response is substantial, and the European region is no exception to this. Recent cases of chikungunya in France and malaria in Italy are a testimony to this, so no doubt about the seriousness of the problem. The question now before us is, should the European region develop a regional plan on vector control? It is true that Resolution WHA 70.16 urges the Secretariat to develop regional plans as appropriate. The Netherlands is not against developing a regional plan on vector control as a matter of principle. However, we find the rationale for a regional plan on vector control as set out in Information Document 5 at this moment not sufficient. It is mentioned, e.g., that the proposed regional plan would be built on the lessons learned from the implementation of the framework for surveillance and control of invasive mosquito vectors and re-emerging vector-borne diseases in the WHO European region 2014-2020 and address its gap in the field of vector control. But the question is, what are the lessons that we have learned? The first report on the framework on invasive mosquitoes and re-emerging vector-borne diseases adopted by the Regional Committee in 2013 is scheduled for the Regional Committee meeting in 2018. In view of this, The Netherlands considers a decision by this 2017 meeting of the Regional Committee to develop a regional plan rather premature. Therefore, we suggest the following. At the 68th Regional Committee in 2018, we will have the first progress report on the regional framework for surveillance and control of invasive mosquito vectors and re-emerging vector-borne diseases. This would offer an excellent opportunity to have an in-depth discussion on the added value of a regional plan for vector control. Thank you very much.
Thank you very much to the Netherlands, and I give the floor to Norway, followed by Italy.
Thank you, Chair. I would like to make a few comments on the progress of development of a draft 5-year global strategic plan on the IHR. Norway broadly agrees with the 12 guiding principles and 3 pillars as outlined in the annex to the document under discussion. Regarding the pillar on monitoring and evaluation, we think that the self-assessment reporting tool must be complemented with additional instruments, including the voluntary joint external evaluation tool that so far has proven successful and has been carried out in a high number of WHO member states in many regions. Evaluations should be carried out in such a way that it accommodates potential sensitivities that any member state may have regarding this way of working. We look forward to the WHO consultation in November to discuss the development of a draft global strategic plan. We believe it is essential that the Secretariat itself chairs this interactive discussion at the meeting. We also want to underline the need for the Secretariat in advance of the consultation to explore informally with member states where it may be possible to find a common ground, especially in the area of monitoring and evaluation. Chair, the proposals contained in the draft 5-year global strategic plan originates from the IHR Review Committee after the Ebola outbreak. The committee pointed to several opportunities for strengthening IHR implementation. It is imperative that member states agree on the way forward for this crucial WHO work at the next year's Health Assembly. Thank you.
Thank you very much, Norway, and I give the floor to Italy.
Thank you, Chair. Italy aligns with the views expressed by Estonia on behalf of the European Union member states and wants to focus a little bit on the comments by the Netherlands on vector control that we support fully. This is a very serious topic and must be managed comprehensively and related risk assessed both at the country and regional level. Italy is at the front line as we are now experiencing the possibility of imported malaria to become truly autochthonous due to our persistent population of anophelines, mainly Labranchiae, for which our network of zooprophylactic institutes have put in place a strong national surveillance system. These mosquitoes carry a low but persistent level of competence for plasmodium transmission, and we're now investigating their involvement in the recent death from cerebral malaria we had 10 days ago in Trento. We are also at the beginning of a potentially large chikungunya outbreak in Rome, and obviously we are constantly at risk of importing Zika virus due to our Aedes albopictus population, now ubiquitarious in the country. You may remember we imposed compulsory disinfection of aircrafts coming from endemic countries in all our airports at the beginning of the Zika problem. Italy is now developing genetics-based control technologies that we are going to test in our simulation laboratories of Terni and Siena, in collaboration with the Gates Foundation that provided the first grants for the initial and promising trials on Anopheles gambiae in malaria endemic countries. We hope to be able to launch a real-life experiment by the beginning of next year and to implement a national eradication campaign by 2020. We are aware also of similar campaigns launched in Brazil a few days ago, though with different technologies. This underlines the very advanced state of the discourse that should be considered in light of other incoming vector-borne diseases such as dengue, traveling with transport, trade, people, and clearly facilitated by climate change and environmental degradation. Therefore, building on the Netherlands' comments that we share, We propose to accelerate reviews, data collection, analytical work on the current state-of-the-art, perspectives and risk for the region. We feel that maybe establishing a SCLC subgroup to catalyze work on the matter may save the scope. Thank you.
Thank you very much, Italy. I see no more flags at the moment. So I propose that we then move to the draft 5-year global strategic plan to improve public health preparedness and response, which was already covered, for example, by Estonia and others. Are there any other delegations wishing to speak on this topic? I see none. Are there any other delegations wishing to speak on the regional plan on vector control? I see none. Are there any delegations wishing to speak on developing voluntary global performance targets for road safety risk factors and service delivery mechanisms, which is contained in InfDoc 4? I open the floor for discussion on this. Austria, the floor is yours.
Danke, Frau Vorsitzende. Thank you, Chairman. I'm grateful to the Regional Office for giving me the possibility of expressing my opinion on this issue of global performance targets for road safety risk factors and service delivery mechanisms. We think that the number of deaths as a result of road accidents has been increasing. And therefore, there is a need to improve road safety measures if we intend to bring that figure back down again. It is Austria's feeling that given the target of 0 deaths that we have, we're being extremely ambitious, and we also feel that this is a target it may be difficult to reach. What we need is clear principles so that member states can use them to submit an annual report. Austria has a couple of technical observations it would like to make on the tables and the details therein, and if you agree, we will submit those in writing. Thank you.
Vielen Dank, Österreich.
Thank you very much, Austria.
Then I see no more member states wishing to speak. Then I will move to NGOs, and I give the floor to Alzheimer's Disease International.
Thank you. Madam Chair, Madam Regional Director, distinguished guests. We are pleased to note the recognition by the Regional Committee meeting of the unanimous adoption of a global action plan on the public health response to dementia. We also note the initial list of regional implications in your agenda item 3, and that prior to the global plan, this region took steps in its Healthy Ageing Plan 2012-2020 to include certain quality of care strategies for older people, including dementia care and palliative care for long-term care. The global plan provides a framework with priorities and targets that are ambitious in respect of a comprehensive public health response to dementia. There is broad agreement on what policies to adopt, but as the OECD observed in Addressing Dementia in 2015, ensuring that these policies are consistently implemented remains a challenge, and there is still much uncertainty about which policy approaches are most effective. With that in mind, ADI suggests there are 4 priority challenges within many. Firstly, the global plan calls for comprehensive national-level government plans, and though many European countries have taken this step to review their own data, situation and strategy, many have not. And the evidence suggests plans need to be regularly updated. ADI would be willing to be a knowledge partner should the Secretariat or Committee organise some form of knowledge exchange aimed at supporting national plan development. Secondly, the plan moves forward the establishment of a global dementia observatory, which has several European pilot sites and engagement of European institutions in the consultations that led up to its initial work. It is a matter of frustration to policymakers and advocates alike that data on dementia is not mainstreamed in national data sets and is of uneven quality. ADI welcomes the potential of the Global Dementia Observatory to improve this situation if European nations and Secretariat take full and rapid advantage of the tools and knowledge from the observatory workstream. We look forward to the reviews of the global plan in 2020, 2023 and 2026 as part of an important learning process. Thirdly, the global plan recognises that dementia shares risk factors with other NCDs and calls for more complete integration of brain health and dementia risk reduction, messaging and action into NCD prevention efforts. This is important and could help to reduce people's risk of getting dementia, but there is a need to go further and to make the public aware of the link between physical health and brain health and to prioritise dementia prevention within a greatly increased dementia research budget. Finally, the plan recognises in proposed actions for Member States the importance of systematically shifting the focus of care towards community and home-based settings and multidisciplinary community-based networks that integrate social and health systems and provide quality care and evidence-based interventions. This has been a major challenge in many countries and could usefully be a focus for sharing knowledge in respect of approaches to system change to improve the quality of dementia in primary and acute care, as well as in respect of new models of community and home-based care. Thank you.
Thank you very much. And I now give the floor to the Secretariat who would like to start. Nedret, Gunel.
Thank you very much. I will address the proposal for the development of a draft regional plan on vector control, and thanks to Italy and Netherlands for the comments. It is clear that there is an increasing trend in the region with some of the recent vector-borne diseases. The examples, as you also mentioned, chikungunya in France and Italy, the malaria risking the interruption of transmission since 2016 with the cases in France, Italy, Cyprus, Greece, as well as increasing number of West Nile viruses. We take note of your proposal to come back to you next year with a comprehensive analysis, including improved data collection on the implementation of the regional framework and propose a way forward. This could be discussed during the lunch session of the first meeting of the Standing Committee for the Regional Committee, also the possibility of having a subgroup on looking into the possible regional plan on vector control. Thank you very much for the comments.
Thank you very much. And I invite Dr. Boudier.
Thank you very much, and thank you to all member states for the very useful comments. Very clearly, the Secretariat is in line with the principle, of course, which has been said, the 12th principle, and we take note of the importance of country ownership, intersectoral work, and integration within the health system of this IHR core capacity requirement. We also take note of the support in general to the voluntary element of the monitoring and evaluation framework, including the joint external evaluations, and the importance also of regional integrations. I would like just to a few words on the consultation process, which is ongoing, starting with the 6 regional committees. Just to say that tomorrow there will be a circular letter sent to all the missions in Geneva to highlight the web-based consultations, which will go up to 13th of October. It's important you using it if you wish to do so. The next element of the consultation process will be this meeting on the 2nd of November, and I fully agree with Norway that we, with the Secretariat, will explore informally how we could find some common grounds to address the concern raised and actually mentioned in the document which was presented to the regional committee. So this being said, I think I have no more comments to say. Thank you.
Thank you very much, and I invite Gauden Galea to respond to road safety.
Thank you very much, and thank you to Austria for your comment on the development of voluntary performance targets in the area of road safety. We simply reinforce your words, highlight the importance of road traffic crashes as a killer in the region. Indeed, while the overall region is declining, we have 8 countries that are rising. This is something that we would like to expunge from the region. Health 2020 monitoring does take into consideration mortality from road traffic crashes, and we heartily encourage all member states to participate with up to 2 representatives in the November process in Geneva to define the performance targets, ideally with a mix of health representative and non-health representative. I also thank Alzheimer's Disease International for their 4 priorities on dementia, which we share, as has been indicated in your reference to our document. And dementia was one of the issues we discussed, however briefly, at the lunchtime seminar earlier this week. Thank you very much.
Thank you very much, and I think it would be helpful if Austria provides their additional comments, hands over them to you as well. Thank you so much. This brings us to the end of this agenda item, and we will now continue with agenda item 5H, progress reports. We will have 2 separate discussions. First on the reports linked to Category 2. The relevant document can be found in EUR RC67/8. There will be no introduction. The other progress reports have been taken forward already during earlier discussions held this week. If this is agreeable to all of you, we will start with reports related to Category 2. Implementation of the European Action Plan to reduce the harmful use of alcohol 2012 till 2020, the implementation of the European Food and Nutrition Action Plan 2015 till 2020, and the implementation of the European Mental Health Action Plan. The reports will not be separately introduced, so I will therefore open the floor immediately. Delegates wishing to speak, please raise your nameplates. The United Kingdom, please.
Thank you. We wanted to comment briefly on the progress report on the implementation of the European Food and Nutrition Plan 2015 to 2020. The UK is supportive of this area of work. By adopting this plan, Member States have taken an important and decisive step towards promoting healthy diets and addressing the high rates of obesity and diet-related non-communicable diseases across our region. In August 2016, we launched in the UK, we launched our Childhood Obesity Plan, which includes the introduction of a soft drinks industry levy, which will come in April 2018. This levy will require soft drinks companies to pay a charge for drinks with added sugar and a total sugar content of 5 grams or more per 100 millilitres. As a result of this announcement, leading retailers and manufacturers have announced that they are or have lowered the amount of sugar in their drinks. We now expect more than 40% of all drinks that would have otherwise been in scope of the levy to have been reformulated before its introduction. Revenue from the levy will be invested in programmes to reduce obesity and encourage physical activity and balanced diets for school-aged children. Thank you.
Thank you very much to the UK for sharing your experience here, and I give the floor to Estonia.
Thank you, Madam Chair. This time, we do not speak on behalf of EU. I am speaking on behalf of the Nordic and Baltic countries, Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. Slovenia align with this statement as well. Since the adoption of the WHO global strategy to reduce alcohol use of harmful use of alcohol and the European Action Plan for its implementation, total alcohol consumption in the region has decreased continuously or remained stable. Nevertheless, Europe is still the region with the highest consumption in the world, which contributes significantly to the mortality from NCDs. Our results so far confirm that evidence-based, sustainable and systematic policy approaches work. It is a message we need to continue communicating because of consumption falls, the more difficult it is to advocate for these systematic measures. Globalization is another tendency we cannot overlook. Countries are today realizing the impact of the borderless world, which affects the preventive measures concerning alcohol-related harm. National measures adopted can be diluted by cross-border shoppings. To address this and other important cross-border issues, including labeling and marketing in new media, a discussion among the EU countries on alcohol policy and possible future steps will take place during the Estonian presidency of the Council of the European Union. Addressing cross-border purchases, marketing and labeling is relevant for all European regions' member states. Legal restrictions on advertising exist in 49 member states, yet the attempts to curb young people's exposure to alcohol advertising are challenged by marketing in new media. An additional challenge is that different requirements concerning, for example, labeling in different countries collide with principles and regulations to ensure free trade. We need continued cooperation and coordination to overcome these challenges. The case of tobacco demonstrates that similar results are potentially achievable as regards alcohol. Therefore, we encourage all member states of the WHO European region to continue their work to tackle the harmful use of alcohol with the support of the regional office. We would like to express our special thanks to Dr. Gordon Kahler and his team for the work in compiling an excellent document, Alcohol Labeling, a discussion document on policy options. Which was made in a limited time frame. It provides evidence-based framework for all member states to rely on in addressing harmful use of alcohol. Finally, although the modeling by the regional office shows that all countries in our region will achieve the 30% reduction of mortality in NCDs by 2020, we can do better. Putting in place sustainable alcohol policy measures has the potential to help us in achieving that. Thank you.
Thank you very much to Estonia for delivering this joint statement on behalf of the Nordic and Baltic countries. Are there any other member states wishing to speak on the European Action Plan to reduce the harmful use of alcohol, the European Food and Nutrition Action Plan, and the European Mental Health Action Plan? I see none. Then we will move to NGOs, and I would like to invite the International Federation of Medical Students Associations to deliver a joint statement. The floor is yours.
Honorable Chair, distinguished delegates, thank you for the opportunity to deliver this statement on behalf of IOGT International, the European Public Health Alliance, the International Federation of Medical Student Associations, the Center for Regional Policy Research and Cooperation, and civil society colleagues addressing non-communicable diseases and alcohol control. We commend the actions of European countries to strengthen alcohol policies in line with the European Action Plan to reduce the harmful use of alcohol 2012-2020. Yet, in Europe, recorded alcohol consumption remains above the global average, with a region annual average over 10 liters of pure alcohol per adult, and consumption in some countries up to 18 liters per year. We are thus concerned that member states are off track to achieve global targets to reduce harmful alcohol use and premature mortality from NCDs by 2025. Harmful use of alcohol is a known risk factor for NCDs. Youth, in particular, are vulnerable to alcohol-related harm, and there is a formidable body of evidence which illustrates the connection between the age of onset of alcohol consumption and alcohol use disorders. Furthermore, alcohol is the world's #1 risk factor for ill health and premature death for the core of working-age population. Therefore, addressing population-wide alcohol use through implementation of evidence-based best buys contained in WHO's Appendix 3 is a key prevention strategy to reducing preventable disability, suffering, and premature death. At the 17th World Health Assembly, Estonia, Latvia, and Lithuania called for WHO to consider the impact of the 2010 Global Alcohol Strategy and Ways Forward, and together with Norway, supported a call by the Southeast Asian region and Botswana requesting the Director General to initiate and resource an expert committee to report on the alcohol control situation and progress prior to the UN high-level meeting in 2018. In light of the discussions here this week about the need for more prevention and the focus on the 2030 agenda, tackling alcohol as an obstacle to sustainable development within this region is essential. We urge European member states to lead on taking forward the World Health Assembly calls for more attention to alcohol control, and to lead on elevating the harmful use of alcohol as a global priority at the forthcoming Executive Board meeting in January 2018. Thank you.
Thank you very much. In addition to this, we received a written statement by IOGT International. And I would now like to invite the International Society of Nephrology to deliver a statement regarding the European Food and Nutrition Action Plan.
Honourable Chair, distinguished delegates, World Cancer Research Fund International, supported by the European Public Health Alliance, the International Society of Nephrology, and the World Heart Federation, welcomes the progress report by the WHO Regional Office for Europe on the Food and Nutrition Action Plan. Encouraging progress has been made by member states to develop, implement, and evaluate policies to promote healthy diets and address the high rates of overweight, obesity, and diet-related NCDs. We recognize the important role the WHO Regional Office for Europe has played in moving evidence into action, notably through the development of a regional nutrition profile model, the publication of the report on protecting children from digital marketing of foods high in fat, sugar, and salt, and the initiative to draw attention to maternal and infant healthcare issues and obesity prevention, and the need for ensuring consistent best practices across the region. These efforts have supported several member states to develop food procurement guidelines and regulations in public institutions, fiscal policies, and front-of-pack labeling. However, the prevalence of overweight, obesity, and diet-related NCDs remains a critical high, with lower-income countries struggling to make progress and social inequalities and obesity persisting across member states. Ensuring policy coherence, addressing the commercial determinants of weight, and adopting a range of strategies which improve food systems and food supply is vital to promote healthy and sustainable diets. As such, we welcome future initiatives by the WHO Regional Office for Europe to support member states to analyze and address how incentives in the food supply chain can be improved to promote, protect, reinstate healthy and sustainable diets. Further, we encourage the WHO Regional Office for Europe to develop regionally appropriate support and guidance to member states by building on the work done to date by the WHO on defining the inappropriate promotion of foods to infants and young children, and on preventing and managing conflicts of interest in policy development. Finally, we call on member states to prioritize the further implementation of the Food and Nutrition Action Plan, develop national evaluation strategies, and lead through social innovation to ensure the burden of preventable diet-related NCDs is significantly reduced by 2020. Thank you for your attention.
Thank you very much. And this concludes our work on the progress reports and on this agenda item. Before we break for coffee, I want to remind delegates that unlike other years, we will not receive a draft report of the first days of the Regional Committee, as we will not review the report during the session. The full report will be sent to Member States early October for comments to be received by the Secretariat by the 25th of October. The final version will then be circulated for approval beginning of November. And yeah, so there are no comments. Then we can break for coffee, and we will continue our discussions at 10:20. Oh, sorry. Oh, I'm so sorry. I forget Gauden. He would like to respond. Yes, Gauden, please. Just a few minutes.
I'll very quickly reply under this pressure of coffee withdrawal. Thanks to the UK, one of many countries showing leadership on levies on sugar-sweetened beverages and how that leads to reformulation of foods. One of the ironies of the situation is that when we look at a single brand of soft drinks, it is the same brand has 23 grams of sugar in the UK and 40 grams of sugar in Turkey and Turkmenistan. So we would really like to see that these companies are placed in a position where they can even out the exposure to sugar across the region, and levies are one way of doing that, as has been shown to be so effective. The civil society comment on commercial determinants, we take that on board very strongly. Our nutrient profiles, regulating the marketing of foods to children, the monograph on digital marketing of foods high in fat, sugar and salt to children, and the work on fiscal policies are intended directly to address that. We look forward to doing more in the coming years. Alcohol, I acknowledge with thanks as well the Nordic, Baltic and Slovenia comment. We are committed to continuing to engage with the Estonian presidency, including with their conference at the end of October on this subject, and we would like other countries to look at the guidance that was developed on alcohol labeling. As has been so much demanded by so many member states and indicated in our progress report, there is actually a alcohol policy in action publication that is pending for later this year. We have collected the policy status of all 53 member states in response to a questionnaire, have tried to weight these different policy dimensions, and are trying to come up with, and have come up with a weighted policy score that I think each country will use for its own information to decide how to go forward in the area of alcohol. I briefly but heartily acknowledge the work of Lars Müller, who is behind me, who has been behind all the work that we have presented here, but for whom, like for Galina earlier in this meeting, this is the last regional committee. He has already retired. We've pulled him out of retirement to be here at this moment. So thank you to all the member states, but also thank you to Lars for your contribution.